Hi, today we're going to have a teach back on 3 chapters: digestive, urinary, and reproductive system. These 3 systems are very important, particularly the digestive system. One of the things we do for our patients is to feed them. So it's essential, therefore, we go over the digestive organs, right? So what do you exactly mean by the word digestion? Digestion is the breakdown of food into small particles, right? So such as this. When I put the food into, or in this case a candy, into my mouth, it's called ingestion. Perfect. The moment I chew the food, what's another word for chewing? Mastication. After you, what is mastication? It's a form of mechanical what? Digestion. So digestion can either be mechanical, such as when you chew, and then the other one is what? Chemical digestion. In chemical digestion, essentially what happens here is that, what do you have? Enzymes. In the mouth, secreted by the salivary gland, salivary amylase. And what does this enzyme do? Digest your starch, a form of carbohydrate. So you put your bread into your mouth, you put your pizza, pasta, fettuccine, it begins to have chemical digestion. At the same time, there's also mechanical, because you are what? Chewing with your teeth. Make sense? Yes. What happens after ingestion, putting the food into the mouth? Chewing is mastication. And what comes next would be swallowing. What's another word for swallowing? Okay, deglutition. So from ingestion to mastication, next is swallowing, which is deglutition. So the food now, from the mouth or oral cavity, where does it go? It goes into your pharynx, oropharynx. What else? Laryngopharynx, then esophagus. Then next, from the mouth, it goes into the esophagus. From the mouth, the pharynx, esophagus, then what's next? Stomach, small intestine, just 3 parts, duodenum, jejunum, and ileum, and then what? The large intestine, right? Okay, so the large intestine is made up of the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. Okay? So, it's like a continuous what? Muscular tube. From the mouth, oral cavity, into the pharynx or throat. The pharynx is made of 3 parts: nasopharynx, oropharynx, laryngopharynx. So which part is behind the nose? Nasopharynx, because naso means nose. Which one is behind the mouth? Oropharynx, because oro means oral cavity or mouth. Which one is found behind the larynx? Laryngopharynx. Okay? Now, from the pharynx, mouth, pharynx, then what? Esophagus, which extends from the pharynx, passing through the neck, then the thoracic cavity. The heart is there, but it is there too. Then it pierces the diaphragm, and then now the diaphragm is here. Now you have your stomach. Right? Okay. Let's do it one at a time. So let's begin by studying the structures here. In the mouth, you have your teeth. Important for mechanical digestion through the process of chewing, because when you chew, you break down the food into small particles. Okay? So our teeth, what we call the outermost layer of the teeth, enamel, followed by the dentin, right? Then you have your root canal, where you have the root cavity. And what is the nerve supply to the teeth? What cranial nerve is involved in the supply of the nerve supply to the teeth? That's why every time you have a toothache, trigeminal nerve, perfecto. And trigeminal nerve is cranial number 5, Cinco de Mayo. 5, cinco, Okay. The trigeminal nerve has 3 branches. V is Remember the V is for Roman numeral 5. Roman numeral 5, V as in victory, but V as in victory. You have V1, which is the ophthalmic branch. V2, which is what? The maxillary branch. And V3 is what? Mandibular branch. So which one is important for the upper teeth? Maxillary branch, because the upper teeth is attached to the maxilla. On the other hand, the lower teeth is attached where? The mandible, to the mandibular branch. So every time you have a tooth decay or a dental caries, if there is a hole, is it possible for a grain of rice to enter that hole? Will that grain of rice irritate the trigeminal nerve, causing too much pain called a toothache? Yes. Sometimes you can't even sleep at night, right? Okay? So every time you experience that pain, it's because of the cranial nerve number 5, the trigeminal nerve. Now for the V1 here, it's just whenever something enters the eye, like a dust particle, are you supposed to rub your eyes like this? No, just cry. And let the tears what? Allow the dust to flow, because if you do this, will that cause corneal abrasion? Then you become blind. If it gets infected, you get blind. Blindness occurs. What happens? But don't worry, we can do a corneal transplant. I've never done it, but I can do it for you for free. Okay? I'm just joking. Okay? Now, so from the moment the food enters the pharynx, the esophagus, it's important during the act of swallowing, right? Now, so in the mouth, how many salivary glands do we have? The parotid gland is behind or in front of the ear. The parotid gland here. What is the gland of the salivary gland that is below the mandible? Submandibular gland. Sub means below. What about below the tongue? Sublingual gland. So these glands are important for the secretion of saliva, which is designed to moisten the food to facilitate the swallowing process. You know how difficult it is to swallow whenever there is what? Dry food. You don't want it to be moistened by the saliva we have. And not only that, what does the saliva contain? Salivary amylase. Make sense? Okay. Now, I don't know if you heard about this. Have you heard of mumps? When you were a young kid, you were given what? Mumps by MMR. Mumps, measles, rubella virus shots, right? To protect you against all these 3 organisms. Whenever there is mumps, now which is not commonly found here in the United States, mumps involves the parotid gland. It's called viral parotitis. The mumps virus will attack the parotid gland, causing it to become inflamed. Inflammation of any organ causes it to be painful, swollen, okay, and red. Now, the problem is that especially men, whenever you have viral parotitis due to the mumps virus, the mumps virus will not only stay there, but it loves to travel. It's like a tourist. It likes to go to where? The testes. What happens if it attacks your testes? What happens if you have orchitis? What is orchitis? Inflammation of what? The testes. Guess what? All the sperms will be destroyed. You become what? Sterile. You understand? So anybody here in this class who has mumps today, you are exempted. I'll just give you a copy of my lecture. No, I'm just kidding. I don't want to be sterile. Although I already have 3 kids, but you know, my wife might decide to have another baby, but in vitro, whatever, okay? Now remember this, once the food now is going to be swallowed into the esophagus, it's a muscular tube, right? It enters the stomach via, as long as it penetrates what do you call this opening here in the diaphragm where the esophagus penetrates? What do you call that portion? If this were the diaphragm, it begins with letter H and ends with S. Huh? What is it, Sivak?
I said hilus.
You know what? Hilus? It almost is similar to that. It's called the hiatus. H-I-A-T-U-S. H-I-A-T-U-S. It means if this were the diaphragm, there's a hole. And that hole is where the esophagus will go through. So let's create a hole here. So if this were the esophagus, this is the diaphragm. Esophagus goes here, and the stomach is down here. Okay? That's why some of you hear the word esophageal hernia coming out to the hiatal hernia from the word hiatus. H-I-A-T-U-S. Now, once the food enters here, what is the first part of the stomach? What's the first part of the stomach, class? It's near the heart, so it must be called what? Cardiac region or cardia. C-A-R-D-I-A. What do you call the second part here? The fundus. The one that goes up like this. What do you call the main part of the body here? Oh, that's the body actually. And this is called the lesser curvature. What about this one? The greater curvature. And what do you call the last part of the stomach? The pylorus or the pyloric region. Here. So let's review. I point to the structure, tell me what it is. First part, cardiac region. Second, fundus. Third, big one. Last one, pyloric region or pylorus. What about this one? Lesser and curvature. Okay? Now, the cardiac region and pyloric region or areas, or the pylorus, if it's just one word, or pyloric region or pylorus, cardiac region or cardia, there's an opening. There's an opening here. That opening is called what? Cardiac what? Orifice or sphincter? Orifice or orifice? Because what does an orifice mean? Hole or hole? My question is, what is the name of the hole? Cardiac? Very simple, right? Don't you love anatomy? It's a very simple class, made of simple words. A hole could either be a foramen, or it could also be an orifice. The more words you know, the more successful you become, because you will be able to understand what you read. How do you spell orifice, therefore? Perfecto, orifice. Now this orifice or hole is guarded by a circular muscle called cardiac, perfecto. Orifice, there's a cardiac sphincter. And what does the cardiac sphincter do? Close what? The opening or orifice once the food goes into the stomach. What for? Why is there a need for the cardiac sphincter to close to prevent the food from what? Backflow. Why do you want to prevent it from backflowing into the esophagus? Because the moment it goes here, will it be mixed with a chemical substance? And what is the name of that substance? Hydrochloric acid. Is that a powerful substance? Yes, it is. In fact, if you have hyperacidity, it can even lead to gastric ulcer inflammation. Can you just imagine, the esophagus does not have acid, and if the sphincter here is not working properly, will you have backflow? Will the food with acid backflow here into the esophagus? Now, what's another word for backflow? Regurgitation. What's another word for backflow and regurgitation? Reflux. Remember what I said? The more words you are, the smarter you become. Create a Google frame of mind. Do not rely on Google all the time. Put that brain of yours full of information. So it's called what? Acid reflux, regurgitation, or backflow. So when I say the patient is suffering, okay, I'm the doctor, you're the nurse, and I say, oh, tonight we're going to have a patient with GERD. What does GERD mean? Gastroesophageal reflux disease. Or I can also say it's called, or otherwise known as reflux esophagitis. Reflux, or it could also mean regurgitation. It could also mean backflow. So is that good or bad? So what would cause the backflow? A malfunctioning cardiac what? Sphincter. So that is what you learn in pathophysiology when you come to me, if you decide to come to me. There are other teachers here. So when it goes there, is that going to be a problem? What is esophagitis? Inflammation of esophagus. And when there is inflammation, will there be dolor or pain in Spanish? Dolor means pain, right?
Yes.
Entonces, Pedro, ¿habla el español, señorita? Sí. Muy bien. So dolor is pain. So when these patients have the backflow of the acid into the thoracic cavity where the heart is area, will there be chest pain?
Yes.
See? It's called chest pain, right? Okay. Now, So the reason why there is backflow is because the sphincter is not working properly, right? Okay, now, what about here? When you have a pyloric region, do you also have an opening there?
Yes.
That leads into the duodenum here. And what do you call that opening in the pyloric region? Pyloric what? ONG, productive. It means the same thing, orifice. And what is guarding that pyloric orifice? The pyloric sphincter. It's a circular muscle again that once the food enters the duodenum, would you allow the food to backflow into the pyloric region? Not anymore. And what prevents the backflow? It's called the pyloric. Do you understand? Okay. In the stomach, just like any organ here, whether it's small intestine, large intestine, it has 4 layers. Stomach, small, large intestine, that has 4 layers. The first layer, if this were the stomach, is called the mucous membrane or mucosa. What is found below the mucosa? Submucosa. Sub means below. What's the third layer? The smooth muscle layer. You have the inner circular and the outer longitudinal layer that is found in the small large intestine. But in the stomach, you have a third layer called what? Oblique layer of smooth muscle. Now, why do you think the stomach has a third layer or a thicker layer of smooth muscle? Because what does it do? It contracts in order to what? Grind the food. Okay? It's part of what we call mechanical digestion. Right? So when the food is being churned, do you know what churning means, right? C-H-U-R-N, churn. It basically does mechanical digestion, similar to when you have what? A blender or austerizer. Okay? I remember when I came here in 2002, the first time I talked to a vocational nursing class, I had to make my class more interesting. I bought a blender in Sears. I got the blender, I hid it in my table, and I said, the stomach is like a blender. To make it more interesting, I said, what did you eat this morning? And somebody said, hot dog. I prepared hot dog with me. What did you eat? Bacon. I had bacon with me. What else? Rice. I had rice. Bread. I had bread. Banana. I had banana. And then I said, what is 66% of your body? Water. So I had water with me. I poured the water on the blender. Oh shit, what happened? Spilled on the table, and oh my god, there's a perforated stomach ulcer. Class, there's sponge. But unfortunately, I did not know how to operate a blender. What happened? I forgot to what? There's a locking mechanism at the bottom of the blender which should have been locked, which I failed to do. So I told, for every problem, there's a solution. So once in the race, Dr. Gamo, you failed to lock the one. Oh, you are right, okay? So the problem was solved. So the stomach is like a blender because, remember, what does a blender do? Blenderize, you end up with what we call chyme, C-H-Y-M. What is chyme or chyme? It's the effect of a stomach on the food itself. It's because liquids, like it is liquid and solid particles. It's very small now, okay? Do you understand? Now, in our stomach, did I mention the fourth layer? The serosa. Smooth, so let's review. Mucosa, submucosa, smooth muscle layer made up of inner circular, outer longitudinal, smooth muscle, and the third one is oblique. And the fourth layer is called what? The serosa or the serous membrane. Now, the question is, which one do you think has the blood vessels? Is it the mucosa, submucosa, or the smooth muscle layer? Smooth muscle layer. Now remember this. Remember when you have so much of the acid, plus there is a bacteria called what? H. pylori, it causes you to develop what? An ulcer. And guess what? Can that ulcer bleed? Yes. Why? Because the muscle has what? Blood vessels. And the entire layer has blood vessels. Whenever there are cells, you need blood vessels. So can you have a bleeding ulcer? Yes. Can you vomit blood if you have a bleeding stomach ulcer? Yes. Of course. Can you have blood in your stool? Yes. If it's black, it means the bleeding is so slow yet, not so much. It takes a long time for you to travel. What kind of color? Normally your stool is what? Golden, yellow, brown. Or golden, yellow, greenish, brown. If you don't believe me, hold tonight and look at your poo-poo. Second, when it's blood, it becomes black. Tar, T-A-R, so black tarry stools, T-A-R-R-Y. Okay? If it's fresh blood, if the amount of blood is too much, or if you have lower GI bleeding rather than upper GI bleeding, it will be fresh blood. Now, there are terms we use in the medical field. If it's black tarry stool, we use what? melena. If it's fresh blood, how do you know it's cherry red blood? We call it hematochezia. Okay? That is abnormal. Now, in the stomach wall and the cells that are formed in the layers of the mucosa, you have parietal cells. What do parietal cells secrete?
Intrinsic factor.
And what else?
Hydrochloric acid.
Hydrochloric acid. Perfecto. So two substances. So these are the things you're supposed to know. And it seems to me that some of you heard it for the first time. Okay? So let me see. Who wants to volunteer without, because she has notes? Is that in the study guide?
Yes.
Oh my gosh! How come you're the only one with the study guide with the answers? It's okay. Okay, tell me, what is the role of intrinsic factor? Anyone? Aside from her? What's your name again, my dear? What's your name?
Azel.
Huh?
Azel.
Roselle. What's the last name?
Reynoso.
Reynoso. Except for everybody else. Give me the answer. What is your intrinsic factor for? If it's study guide. Yes?
Absorbs vitamin B12.
I like you already. You're both hired. And what is another name for B12? See? The questioning do not end. Because that is what you call deep learning. What is deep learning? Going beyond. Just because I put there study guide, you go beyond that, right? So you are absolutely right, my dear. Intrinsic factor is important for the absorption of vitamin B12. What's another name for B12? Anyone who knows? It begins with letter C and ends with N. Yes? Okay, you can now answer because you use the Google. The rest of them don't care. I did Googleize it? Googleize it, you know. Anybody? It's called cobalamin or cyanocobalamin. Now, why is it important for us in the medical field? Intrinsic factor is important for the absorption of vitamin B12 or cobalamin, which is important for the production of what? Red blood cell or red blood cell? So if you lack intrinsic factor, you won't be able to absorb B12. What kind of problem do you develop? Pernicious anemia. Anemia. And don't worry, you'll learn this in pathophysiology. But what is the basis for pathology? Normal anatomy. Aside from intrinsic factor, what else is a parietal cell secrete?
Hydrochloric acid.
Very good. And why is the hydrochloric acid important for chemical digestion? It's supposed to what? Digest the meat, the source of protein. Is it acid or acid? It is. Is it powerful or very powerful? It can even cause the stomach to develop ulcers if you have hyperacidity, right? You understand? And it's related to the vagus nerve. Remember vagus nerve for digestion? Part of what? Autonomics, parasympathetic. In fact, what do? We cut the vagus nerve for hyperacidity and causing what? Severe bleeding if of gastric ulcer. Who does the cutting? The surgeon. Who will the surgeon? You. You understand why we have to cut the vagus nerve? Because the vagus nerve causes the acid to be secreted more in hyperacidity. Okay. Now, what about your chief cell? If the parietal cell secretes hydrochloric acid intrinsic factor, what does the chief cell secrete? Yes? At the corner, what's your name in there? What does the chief cell secrete?
I'm not sure.
You're not sure? It's okay. Would you like to call a friend?
Sure.
Who is your friend in this class? You have a friend in this class? Huh?
She's not here. I don't know where she's at.
Don't you have a lab class? Who's your partner in the lab?
I don't have a partner. We don't have a partner.
Who is your lab teacher?
Miss Moore.
Miss Mark. Okay. Yes! Bob. Huh? What is it? Pepsinogen. Okay. Now, what is pepsinogen? Pepsi, not Coke. Okay. So pepsinogen becomes pepsin because of the action of what? Brandon, the effect of hydrochloric acid. So hydrochloric acid from the parietal cell will cause the breakdown of pepsinogen into pepsin. And what is pepsin? It's a protein enzyme breaking enzyme. It's a protease. Remember amylase, protease, enzymes? So what is protease? And what does it digest? Proteins, right? I don't want to be out of the frame. So what does pepsin do? It's a protease. Digestion of what? Chemical digestion of proteins, right? Now, so once it is now churned, it now becomes a chyme, CHYME. Where's the next step? Duodenum. Okay. In the duodenum, followed by the jejunum, followed by the ileum, all of these is 20 feet long. Make sense? Now, what is the most important function of the small intestine? Here, in this duodenum, you have your pancreas, and then the gallbladder is here. This is the liver here. The pancreas releases its pancreatic enzyme here in the ducts, right? What are the two ducts of the pancreas in the duodenum? The main pancreatic duct. What's another name for main pancreatic duct? Wilson. And what's another name for the accessory duct? These are all in your books, if you have read your book, okay? Maybe not Wilson. It's called Santorini. Who is Santorini? I was told this Greek guy. I don't know. I don't know if there's Wilson and Santorini there, but this main pancreatic duct and what? So what do these ducts do? They allow the release of enzymes by the pancreas into the duodenum. That makes the pancreas an exocrine gland. But at the same time, it's also endocrine because of the islets of Langerhans. Remember, alpha cell, glucagon, beta cells, what? Insulin, right? And then delta cell, somatostatin. So, what about the liver? Produces what? What does the liver produce? Bile. And then the bile goes to the hepatic duct, then goes to the cystic duct, and what happens to the bile? It is stored where? So what organ produces the bile? What organ stores the bile? So how does it happen? Liver, bile, hepatic duct, right and left hepatic duct, common hepatic, cystic duct, stored here. Now when is bile released? The moment there is what? Fat in the duodenum, there is a substance called cholecystokinin released by the wall of the small intestine, causing the gallbladder to what? Squirt the bile, and the bile goes where? Into the common bile duct. The common bile duct is formed by the hepatic duct and the cystic duct of the gallbladder. So cystic duct, common bile duct is formed by the hepatic and cystic duct. And where is the bile released? Into the duodenum. Does anybody know what is the function of your duodenum? Oh, I'm sorry, the bile.
Breakdown of fats.
Yes?
Breakdown of fat.
Okay. Are you sure it's breakdown of fat? Remember, lipase is going to break down your fat. Protease is going to break down your what? Protein. So lipase from the word lipid. Lipid is fat. Amylase for starch. So do you think bile is going to digest the fat?
And that's with the breakdown in the
Okay. I mean, I mentioned this already in the lab. Who are my lab students here? Raise your hand. Lab students. There you go. Jacob? Underwood? Anyone who knows? Who was your lab teacher? Is it me? What did I tell you in class? Did I say anything in class? Did you learn anything from me?
Yes.
I might have mentioned this, right? Miss Nalomansi? Why am I smiling at you, Miss Nalomansi? You don't know I'm smiling at you? Okay, the answer is correct. Now, explain to me what is emulsify. So sometimes this is our dilemma. You know, millennials, they love to memorize, but sometimes they know the answer, but they don't know how to explain. Deep learning requires you to be able to explain things. You see the word emulsify. Yes, my dear. Soften. Okay, I'll give you a clue. We're talking about fat. Fatty oil. Have you ever mixed fatty oil with water? Yes or no? Can you mix fatty oil with water? No. Oil will float. Water they can't mix. But what will bile do? It allows the mixing of what? Oil and water. And what does that mean? That's the role of what? Emulsification. Now why is that important? I'll tell you why. Okay, here. The moment the food that is fatty here enters, the bile is released by the gallbladder, allowing, is there water in the chine? There is. Is there water in the wall, in the blood vessels, in the blood? There is water. So you want the bile to allow the mixing of the fatty oil so that it will facilitate what? What is next after chemical digestion here by the lipase? Absorption of nutrients. What is absorption? The definition is very simple. Transfer of food nutrients into the blood circulation, which is plasma. Plasma is water. If you remember, what is found in the wall? Mucosa, submucosa, smooth muscle layer, and serosa. Where do you find blood vessels there? And this blood contain water. Yes. And is there water here together with the trunk? Yes, there is. So you need that to mix it at the same time, allowing the fatty oil to mix with the water so that it will facilitate what? Absorption into the wall. What is absorption again? Allowing all the nutrients. Now, if the food you eat has sugar or glucose, will that glucose go into the blood? Found in the blood vessels in the wall of the duodenum, jejunum, and ileum. Yes, it is going to happen. There's a reason why after a meal, what happens to your blood sugar levels? Now, what happens if you have a stone here? Gallstone. Will that obstruct the flow of bile in the bile duct? Will there be bile here? No. If there is no bile, can you mix the fatty oil with the water?
No.
What happens to the fatty oil? Can it go to the wall and into the small intestine? What happens to the fat? It goes all the way to the poo-poo. You end up with fatty stools. Does anybody know what's the term used to describe your fatty stools? Huh? Almost, but not quite. You're an LVN, right? That's the advantage of being an LVN before taking up RN, because many of the questions in the RN exam are the same. It's called what? Steatorrhea. Not North Korea, not South Korea. It was steatorrhea. Will this come out in the nursing board exam? Can I be able to explain the pathology? Yes. With bile obstruction by a stone, the bile is not present. What happens is that the fatty oil does not mix with the water. It's not absorbed into the small intestine. It just goes where? You have fatty stools. What I'm trying to say, there is no question in the nursing board exam that you cannot answer. You should be able to answer. Okay, exactly. Now, okay, what's next? So, are we good with the pancreas, liver, and gallbladder? Now, what are the other functions of the liver? Liver is not only for the production of bile, but it's important for what? Detoxification, removal of toxins. Third is where your clotting factors are produced. Make sense? In the process of clotting, you don't just need the platelets. You also need what? Clotting factors like prothrombin, right? Fibrin, fibrinogen. Okay? That's why, what organ produces that? The liver. That's why if you drink too much alcohol or you have hepatitis B infection, can that lead to liver cirrhosis? Will you be able to produce enough clotting factors? No, you end up with bleeding lesions on the skin, which you will learn in pathophysiology. Okay? Now, which is more important, the gallbladder or the liver? Liver, because, as I said, clotting factors. Second, your nutrients. All the nutrients here absorbed by the small intestine, which is 20 feet long, will be brought to the liver by the what blood vessel? Hepatic portal vein. Remember? What blood vessel? So you have the superior mesenteric vein, inferior mesenteric vein, splenic vein. They form the portal vein, and when they form the portal vein, it brings all the nutrients that were absorbed to be stored where? In the liver. That's how important the liver is. That's why if you remove the gallbladder, do you die? No, you don't. Why? Because even if you remove the gallbladder, the bile will just go directly where? Hepatic duct, common bile duct, and on into the duodenum. Is that clear? Is that clear? Now, in the small intestine, what is present that you increase the surface area? What is the unique feature of the small intestine? Aside from the fact it's 20 feet long. Anyone? Is that in my study guide? Small intestine. Anybody who knows? It's called the finger-like projections there. Yes? Right there, what did you say?
The villi.
Is that there in your notes? Or based on your reading?
I remember once you said it.
When is the final exam? Next year or on Wednesday?
It's Wednesday.
Okay. So I presume all of you have the same study guide as hers. And can I borrow your study guide, please? Is this what you printed out in my study guide list?
Yes.
So I have here the parietal, the chief cells. And I cannot read your handwriting. See? Liver and structure, gallbladder structure and function. If you just study my study guide, you must get a perfect score. Okay, go over there. Okay, so, do you have any questions regarding the... So what did you say again? What was the answer to my question? How do you spell villi?
V-I-L-L-I.
So microvilli, okay? Finger-like projections, it increases what? The surface area. Why? Why do you want an increased surface area? Of course, you want to absorb more. Do you realize that the small intestine is 20 feet long, while the large intestine is only 5 feet long? So which do you think is more important? Small, because that is where the absorption of nutrients. You know what absorption means again? Transfer of the food in the wall, inside the lumen of the small intestine into the wall, and the wall contains what? Muscles and blood vessels and blood. All the nutrients will go to the blood, but will they stay there forever? No. All the proteins, all the carbohydrates, and all the fats will be traveling to the liver through the hepatic portal vein. So make sure you read that. Now, once all the nutrients are absorbed, it now goes into the cecum, in the area called the ileocecal valve. It prevents backflow. The cecum now, because you have removed all the things you need, the nutrients, what is left is what? S-H-I-T. What is H-H-I-T? Stool, right? Or waste, or feces, poo-poo. So once it goes here, it's all poo-poo. But the question now is, what is in the poo-poo or waste or feces or fecal material that is important? Water. So what happens? Remember the word, what is peristalsis? The alternating wave-like contraction of smooth muscles in the wall. Stool goes up, goes up. The water here is absorbed into the what? Into the wall. What does the wall have? Muscles. What do the muscles have? Blood vessels. What's the blood vessels? Blood. Blood what contains what? Water. So whatever water you find here is absorbed. So as the stool travels, stool goes up, stool goes up, to the left, to the left. The amount of water in the stool becomes lesser or lesser? Because it now goes where? Into the wall. So by the time the stool comes out here, splash. The solid stool goes into the toilet bowl and you feel so good. Why do you think it's called bowel movement? It's because of the peristalsis. Small bowel movements and large bowel movements. Large bowel, large intestine, small bowel. Okay. So, what happens when you have diarrhea? In diarrhea, what happens with the peristalsis? Fast or very fast?
Very fast.
Will there be enough time to absorb the water?
No.
So the water remains where? In the stool. What kind of bowel sounds? If you put a stethoscope, hyperactive bowel. Diarrhea, hyperactive bowel. What about constipation? Hyperactive or hypo? So it will be something like this. What about normal active? A little bit faster in between. So. Now you might be laughing now, believe me. When you become nurses, the surgeon will ask you, does the patient have any bowel sounds after surgery? Because that's the time you start what? It's okay, it's not your fault. Feeding. Does it make sense? Because that means it has returned back to normal function because your bowel sound, right? Does it make sense, guys? Okay, now let's go back to this. So the stool comes out here. You have an anal sphincter. There are two, external and what? Internal. Which one is skeletal muscle? External. Which one is smooth muscle? Internal. Which one can you control and voluntary? External. Okay. Do you understand? Now, are there any questions regarding the digestive system? Liver, gallbladder, pancreas, we covered that. I think more or less, right? Is that clear? Now let's move on to the urinary system. You still have enough? You still have enough? Okay. The urinary system is very simple. Why? First of all, you have what? Tell me to get the eraser, please. Tell me to. Oh, it's on top. Oh yeah, I can see it. Okay. Let's move on to the urinary system. Continuation, we'll teach back this time on the urinary system. Okay, so the most important organ here would be what? The kidneys, right? You have a right kidney and the left kidney. The ureters, the urinary bladder, the urethra. The right kidney is lower than the left. Why is the right kidney lower than the left? The liver is here. It pulls down. The spleen is not as big. It's over here. Right? It's lower than the left. So this is the ureter. This is the bladder. It's not gallbladder, but it is otherwise known as what? Urinary bladder, and then urethra. Both men and women have urethras. Now, what is the name of the blood vessel that brings blood to the kidney? Okay, from the aorta, right? Abdominal aorta, renal artery. What is the name of the blood vessel that brings blood away from the kidney? The renal veins. And where does the renal vein go? Inferior vena cava, renal vein. And then the renal vein goes where? To the right atrium of the heart, right? Aorta came from what? The left ventricle of the heart. Vein, right? So the diaphragm is here. Thoracic aorta, abdominal aorta. Let's remember the word circulate. So the blood goes to the kidney via the renal artery from the aorta with oxygenated blood. The blood that is rich in carbon dioxide, which is the venous blood, goes to the renal vein and goes where? To the right atrium. So it goes from the heart, goes back to the heart. So why does it have to pass through the kidney? Because what is the main function of your kidney? Filter what? What does it filter? What does the kidney filter? Blood, of course. Believe me. When some students come to me in pathophysiology, I tell them, what does the kidney filter? Do you know what they say?
Water.
Exactly. Well, they say it's even worse when they filter the urine. How can you filter the urine when it's really waste? You filter the blood in order to produce waste in the urine. So whenever you say filter the urine, you are in deep stool or deep urine. But you never understood this concept. What's the next class after this? Physiology. There will be more detailed function studies, right? So this is just a tip of the iceberg thing, okay? So when the blood enters here, the blood contains waste. Does anybody know the name of these waste products? Filter the blood, and what are these waste? So filter the blood to remove what? Or extract what? Nitrogenous waste. So does it contain nitrogen when you say nitrogenous waste? Okay, so what are these wastes? Urea, creatinine, and what's the third one? Uric acid. So what are the three waste products? Urea, creatinine, and what's the third one? Uric acid. Now these products contain nitrogen, that's why they're called nitrogenous waste. So the kidney will remove this waste from the blood and then bring them where? Become urine. The urine now contains the waste. This waste will go with the urine into the ureter, bladder, and into the urethra, into the urinal. If you don't believe me, let's go do an experiment. Let's isolate the chemical substance there, urea, which I can convert into a fertilizer. It can become a rich man. I will collect all the urine there. Okay? Make sense? Now, question now is, so is it the kidney that's important for the filtration of the blood?
Yes.
Cleaning of the blood? Just like the liver, detoxify waste and toxin, but here it's more very specific into these three waste products, correct? Now my question is this. What is the functional unit of the kidney? Nephron. Okay. Amy, what are the parts of the nephron? Is that in the study guide about the nephron? It is? Okay. So you must have your Amy Zhao or Zhu. How do you pronounce your last name? Zhao. I'm sorry, Zhao. Z-H-O-U. Amy Zhao, what is a nephron? It's a functional unit of the. What are the basic parts of a nephron? Ascending limb of the loop of, and what else? So you have a ascending limb. It's called the loop of. So what are the structures before the loop and after the loop? Amy? Anybody who knows? Yes? Proximal convoluted tubule. So you have a proximal convoluted. Believe me, you have to know this. I'll tell you why later on. Okay? What's the other one here? Distal convoluted tubule. What does convoluted mean? Curls. C-U-R-L. Okay? And then here you have your Bowman's what? Bowman's what? Capsule. Did I tell you to study the parts of the nephron? Is this the study of the parts of the nephron? It is, right? Okay. And then the distal convoluted tubule gives rise to the collecting what? Ducts. Now observe, if you have a look at your book, what is the color of the things that you find here?
Blue.
Is it blue? Take a look. Or maybe in a physiology book. Well, there is none, because this is more of physiology rather than anatomy, right? In most books, it's yellow, which means that this is where the urine will flow. Make sense? Okay. Now, what is found in front of the maybe I have the answer. Bowman's capsule. It's called what? Glomerulus. And what is a glomerulus made of? What? What is it? What is it? Okay. Capillaries. And what exactly is a capillary class? Smallest blood vessel. Does it contain blood? Now what am I trying to drive at? What did we say about the kidney? What does the kidney do? Is this where the filtration will occur? And that's exactly what we mean by the word glomerular filtration. Based on your readings and studies, what is the name of the blood vessel before the glomerulus? Afferent what? Arterial. Then glomerulus. Then what comes after afferent? Efferent what? Arterial. Then after that you have peritubular what? Peritubular what? Capillaries. And then you have a series of veins. And then eventually you end up with the renal vein, and then IVC, and then what? Right atrium of the heart. On the other hand, the afferent came from a series of small arteries, the interlobular, lobular, but it ultimately came from what artery? Renal artery. And where did this come from? Aorta. And where did the aorta come from? The left ventricle of the heart. So from the heart to the kidney, and back to the heart. You see how important this is now. What does it mean? It simply means that the blood that came from the heart passes through the kidney. See? Kidney will clean, remove the waste, and allow the waste to go where? In the urine. Now, I'm not so sure if I mentioned this in the lab. Does anybody remember, if you were in my lab class, what did I compare the glomerulus into as a filter? Anyone in my lab class? Anybody who remembers? Who is in my lab class again? Yes. What did I say? Unless I did, huh?
I don't think you mentioned it.
I did not mention it. Maybe we're pressed for time because of AR.
Yeah.
But I think I did. I normally don't fail to do this. Okay. When you go to the kitchen, your mother has a strainer. Did I mention that in class? No? Strainer works, strainer. And what does a strainer have? What kind of hole? Small or small?
Small.
Very small or very small?
Very small.
Very small. Strainer. There's an empty glass. Is there inside? There is something inside the glass? None, because it's empty. Empty glass, strainer. You get an orange fruit. You put the orange fruit on top. What do you do with the orange fruit? Squeeze. What goes out here to the glass?
Juice.
Orange juice. Why did the juice go through? It's so the juice is so watery and it's just basically so small. It came through. It's like your urine. What about the urea, the creatine, uric acid? It went through because they're very small particles. Urea, creatine, uric acid. What about the one on top? What is that on top? The pulp, the seed Why is it that the pulp did not go through? Because the pulp is big and the holes are
Small.
exactamente. So that analogy gives you an idea. This pulp is like your what? Red blood cell. This pulp is like your plasma proteins. Remember, the blood contains plasma proteins. What are these plasma proteins? Albumin and globulin. Why? Because are they considered waste? No, that's why they stay on top. Is red blood cell considered waste? That's why they remain on top. That's your pulp. Why is it that the pulp, or why is it that the red blood cell did not go through? Because the red blood cell is big and the holes are what? What about the albumin and the globulin in the plasma proteins? They were big and the hole is exactamente. What about the urea, the creatine and uric acid? They were small enough to go well. Go through, that's why they go here. Now, you might be wondering, what the heck? How can you explain that physiologically, Dr. G? Very simple. Next term, you go to physiology. Can I make this into a capillary? It's a tube with the blood will flow. See, the blood will flow. Now, you will learn this further that the afferent, the glomerulus, efferent. So this is the afferent. This is the glomerulus with what? What do you find in the wall of the glomerulus? Holes. And below here is the efferent. Which one has a bigger diameter? Afferent. Glomerulus. And then the one here is what? Which one has smaller diameter? Now what will be the effect on blood pressure if you vasoconstrict? The blood pressure will go up or go up? When the blood pressure goes up, remember what I did with the orange juice or fruit? Squeeze. Squeeze. So that is the same principle behind here. When the blood pressure is elevated because of a smaller diameter of the efferent arterial and wider diameter, what will that elevated blood pressure do to the blood? Squeeze. Squeeze. So that the urea and creatine would go out where? In the hole of the wall of the glomerular capillaries. Now let me just find out. It's part of the exam. What do you call those holes in the capillaries? You'll learn about chapter 20, 21, 22, 23 on the cardiovascular system. Some of these capillaries have holes. What do you call those capillaries with holes in the wall? Does anybody remember? Did you not study for the final exam on Wednesday about the different types of capillaries? So there's a correlation between this and capillaries. It begins with letter F. Fenestra or fenestrated capillaries, right? Okay. Now, anyway, so do you understand the principle behind the filtration of the blood? So what is being filtered is blood, not the urine. Because once you filter the blood, what will come out here? What? These three. Why did it go through? Because they're small, they go into the holes, but what pushed them? What squeezed them? Elevation of the blood pressure as a result of what? Small diameter, efferent, big diameter, afferent. So you basically vasoconstrict. Now, this is just a sidebar, or what I'm saying is that later on when you go to pathology, if you know this principle, you have no problem. For example, when you have glomerulonephritis, inflammation, what happens in the holes? Bigger. Bigger and bigger. So the red blood cell go through? Can there be a red blood cell in the urine? So instead of a pale yellow to amber urine, you have bloody red urine. It's called hematuria. From the word hema means blood, turia means urine. Okay? What I'm trying to say, therefore, if you really know your normal anatomy and physiology, if you get an A in this class, 99% you will also get an A in physiology. If you get an A in anatomy and physiology, 99% you will get an A where? Pathophysiology. And if you get an A in pathophysiology, 99% you will pass your nursing board exam. And 99% you can pay your student loans. Which you probably want to happen, right? Okay. Now, are there any questions here? So the bottom line is that the urine will flow to the ureter, into the bladder. What is the name of the muscle in the bladder? Detrusor. Detrusor. And then you have what? Just like in the anal sphincter, external and internal sphincter. You also have external and internal what? Urethral sphincter. Which one is skeletal? Always external. It's the one that you can control. Like last night, I was watching this movie called, the title of the movie, John Wick. I did not sleep. Avengers, I slept for the first hour. Talking. This movie from the beginning to the end. Bang, 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 bang. Okay, so I had to control my what? External, anal, not anal, but urethral sphincter. Amazing. Okay, so that's one of my experiences. It's the same thing I remember when I was watching this movie Triple X by Vin Diesel. Oh my God, same thing. It was like 10 years ago. I wanted to know the ending, so I said external urethral sphincter. The problem was when you go to the rest, everybody's forming a line, and here you are. It's so hard, you know. Do you have any questions? Okay. Now, what else? Do you have any questions regarding the kidney, the urinary tract? So the question now is this: do you know where this is coming from? Where do you get these waste products from? Does anybody know? Anyone? What is, okay, I'll give you a choice. The breakdown of carbohydrates, the breakdown of fat or lipids, or the breakdown of proteins? Of course, there's out of the answer, right? So, Dr. Gamo, what the hell? Do we need to know that for the fact? Maybe not. But for the part of yes. So, whenever you have a patient in kidney failure, that means the kidney is not able to filter the blood properly. What kind of diet? High in protein or low in protein? Low or low? Low protein diet. Why? Because if you give more protein, you produce more what? More protein, more waste. When you break down the protein, as you fellows here, you produce more waste. And the more waste, the kidney is already failing. Why are you going to give it more jobs to clean the... It's like a janitor, you know. If I have a janitor cleaning 10 rooms, one room, the other rooms, on a regular day, like the kidney is cleaning the blood on a regular day, if the kidney is sick or in renal failure, are you going to give the janitor 20 rooms to clean? No. So instead of giving 10, you might just give what, 5 rooms to clean. Okay, sir, you're sick today. Instead of cleaning the 10 rooms, only 5. Same thing. Instead of giving him a lot of protein, just give what? Low protein diet. Will that come up to the nursing board exam? Yo. And that is how you pass the nursing board exam. Part of nursing intervention. And part of medical surgical management. Okay? Do you have any questions here? So how many nephrons do you have in each kidney? 1 million. 1 million in the right kidney, 1 million in the left. 1 plus 1 will give you what? 2 million. Isn't that amazing? Okay. Do you understand? Okay. So that means you and I are multi-millionaires. Isn't that amazing, right? Do you still have enough? Okay, it's brand new according to the verse. So. Do you understand? So the idea here is that it is in the nephron where the urine is going to flow here, but here it's all going to be blood. Everything here will be blood. Blood, 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 blood. Urine. Now you have 1 million of these in each kidney. So one kidney, 1 million, other kidney, 1 million. Now, is it possible to live with only one kidney?
Yes.
Yes, you can. You understand? Yes, you can. Okay? With only one kidney. Is that clear? Any questions on the urinary tract and the urinary system?
Nope.
Yes.
What happens if the stuff stays in your body?
So what?
Like with the waste.
What do you mean? This three?
It's like, how is it like you can't flush it? It's like, say, both your kidneys fail. Like, what's that?
Okay, so that's why you have to undergo hemodialysis. Have you heard of dialysis? DaVita? So these dialysis machines, the moment your kidney fails, we call that acute or chronic renal failure, especially chronic, the dialysis machines are like artificial kidneys. So what happens is this. Have you ever seen a patient undergoing dialysis in these facilities? They lie down in bed. There's a catheter that gets the blood from these patients. And what happens now? What happens is that the catheter of the blood is going to be brought where? Into the machine. What does the machine do? Cleans the blood, and the blood goes back to you. Same thing now. Bear in mind, the normal BUN, what does BUN mean? Blood, urea, nitrogen. From the word urea. And this is the blood levels of urea. Ranges from 8 to 25 milligrams per deciliter. So in others, we don't even remove the entire urea. Some of it's removed, but not all. That's why, how do we know it's abnormal? How do we know the kidney is failing? If it's greater than 25. And what about your creatinine? 0.6 to 1.5. That means the kidney does not remove all the creatinine. It is still going to leave you with this amount of creatinine. How do you know the kidney is failing? If the amount or levels in the blood is greater than what? Believe it will come on the nursing board exam. So when I tell the nurse, the patient is having, what is oliguria? What is oli? Oligo means what? Scanty. How much normal urine output should your patient have per hour? 30 ml. How much? 30 ml per 1 hour. What's another word for ml? cc. So when you start working as nurses, you will be asked, what's the urine output from 7 p.m. to 8 p.m.? And if you tell me, Dr. Gamo, the urine output is 20 ml, is that good or bad? Bad, because below what? 30. Could that be an indication of kidney failure? No. Will I tell the nurse to do what is STAT? STAT means what? Right away. Blood levels of BUN and creatinine. So what specimen are you going to send to the lab? For the BUN? Huh? That's a wrong answer. You will fail the nursing board exam. Because what does the B stand for here? There you go. That is how you pass the nursing board exam now. If I tell the nurse I want stat BUN and she sends the urine specimen, that nurse is not a graduate of West Coast, because the best in the West are you. Don't you imagine? You're the best in the West. Are you going to send a urine specimen for BUN? No, because the B stands for what?
Blood.
So what specimen are you going to send to the lab? Perfecto. What about serum creatinine? Urine or blood? Huh? Serum. Of course, blood. Serum plasma. Oh my goodness. Okay. So both will be blood specimens. The phlebotomist will get blood, send it to the lab, measures the levels of BUN and creatinine, which requires a blood specimen. Do you understand? Okay, let's move on to the reproductive organs, right? So, first of all, let's start with the male. Male, what is the male gonad? Testes, right? Okay. And the testes is surrounded by the scrotal sac or scrotum, right? Okay. The scrotal sac or scrotum has a wrinkly appearance. Like wrinkly. What is the cause of this wrinkly appearance of the scrotal sac or scrotum? What muscle? Dartus. Muscle. Wrinkled appearance of the scrotal sac. When it's cold, what happens? The scrotal sac together with the testes will go up. What causes the elevation of the testes and scrotal sac because of the cold environment? What muscle would that be? What muscle? Cremaster muscle. Now inside the scrotal sac or scrotum is the testes. What is in the testes that is responsible for the manufacture of your sperm? It's in your study guide, which I hope you have been studying for the past week. I think I gave the study guide like 2 weeks ago, right? What part of the test is, when is your exam, by the way? Of course, I know that. But some of you, I think, as if you have not heard of the correct answer for this question, right? So when do you plan to study? Tomorrow night? That's not the best way to study anatomy. This is supposed to be the foundation of nursing. Today is just a review on your part, right? So what part of the testis produces the sperm? Not the epididymis. Yes? Very good. How do you spell it? Did you read on that? Is that your study guide? Okay, you will pass on that question alone. So what part of the testis produces the sperm, my dear? Seminiferous tubule. In your testis, what is the name of that cell that produces the male hormone called testosterone? Anyone? What is the name of the cell in the testis that produces the sperm? Interstitial cell. Perfect. It's only a study guide, by the way. Huh? Right? See, you know they have the answers there? Oh, you're just going to put it for the first time, huh? It's okay. Hopefully by Wednesday you will still remember. And what happens on Thursday, you all forget. I'm not kidding. I've been here for 30 years. I know. And the core nursing faculty, what happened to your students? They all forget the things you taught them. I said, really? It's called cramming. Short-term memory remains short-term memory. We want to convert short-term to what? Long-term. That can only happen if you don't cram, right? Okay, so what is the role of the epididymis? You keep on mentioning the word epididymis. What happens in the if it's produced by the seminiferous tubule? The sperm travels where? To the epididymis to what? What does it do there? Mature. Very good. What else? To mature and be able to use what? Remember the sperm has what? The head, the body, and the tail, or the flagellum. In the epididymis, the sperm is going to learn how to use what? Of course, that's called maturation or capacitation. What we're trying to say, therefore, is this. The sperm is produced by the seminiferous tubule, but it goes into the epididymis to mature and learn how to use the tail. Okay? So it is not the epididymis that produces the sperm. It is what? Seminiferous tubule. Do you understand? Okay? Is that clear? Now, as it stays there, remember the word ejaculation? The point of no return. It's called orgasm. So when a man reaches his point of no return, the sperm will travel from the epididymis to the spermatic cord where you have what? Vas deferens. Remember the word vas deferens? Vasa deferentia or vas deferens. This is what we call vasectomy. It goes to the vas deferens, it goes into the ejaculatory duct, right? And then it's mixed with what? The semen made up. What contributes to the formation of the semen? The prostate, the seminal vesicle, and the bulbourethral gland or the Cowper's gland. So all three of them contribute to the formation of the semen. Now what kind of semen do we have? Alkaline or alkaline? Or basic? Yes. Why? Because the vagina is what? Acidic. Will the sperm like an acidic vaginal environment? It doesn't like. I spoke with them. Do you know that they pray this prayer? I walk in the valley of the vagina, I fear no evil. Because I'm more, yeah, remember the prayer as you walk to the valley of death, I fear no evil. So the sperm is afraid of the acidic environment. Now why is it that the vagina is acidic? To protect women from what? Infection, like vaginitis. The problem is that acidic environment is not good for the sperm. That's why the semen, that is where the sperm will travel, is alkaline. What will this alkaline substance in the semen do? Neutralize the acidic environment where? In the vagina. Do you understand? Okay. So, during ejaculation, which is what? Is it parasympathetic or sympathetic? Sympathetic. What about erection? There you go. I think was it one of the questions in the. There you go. Yeah. Okay. The discussion forum, right? Now, the other thing you have to remember too is that originally, okay, what is the male gonad again? The male gonad is what? The testes, right? The male gonad or sex gland is the testis because it produces what? The sex cells. What are the sex cells? Gametes. Remember the word gamete? Like this. Sex cell. In men, it's called what? Sperm. Or spermatogonium. Spermatozoa. We just use the word sperm. But the seminal first tubule in the testes. In women, it's called the ovule or the egg. Ovules produced by the ovarian follicles in the ovaries, right? In the sperm, the gamete or sex cell is sperm. In women, the gamete or sex cell is the ovule or the egg. So be aware of the differences in terms of which one produces which. Okay? Originally, the testis in the 7th or 8th months of pregnancy is here inside. What does it do? It starts to what? Descend. The testis descends into the scrotal sac. Why? Much cooler, warmer. If they remain here, all the sperm will die. And that child of yours will become what? Sterile. Do you understand? In other words, you need the testis to what? Descend. So remember, I don't know if I made a joke about this in the lab. I said, if you're the mother, you just delivered your baby boy, you're just perspiring because first thing you do is what? Once you have your baby with you, where's my baby? After 1 hour of delivering the baby, the first thing you need to do is grab the balls. Why do you want to grab the balls of your baby? Make sure that the testis has descended. I'm not kidding. If you happen to have a boy, do not presume that the testis has descended. How do you know? Because it's solid. What happens if it's not solid but rather liquid? Like a balloon with water, soft. Now what is the danger there? Not only will that sperm be all dead in here because it's so hot, that child of yours might develop what? Testicular cancer. If the testis fails to descend. Do you understand? Okay. So where is the original location of the testis? It goes down. Okay? Does that make sense? Now women, very simple. Not actually more complicated than men. So if I were the uterus, this must be what? Fallopian tube. This is the fimbriae. Okay. Fundus of the uterus. The body of the uterus. What do you call the lowest part of the uterus? Cervix. Now look at my lips. It's like your cervix. Krispy Kreme donut, you know. The cervix is here. Now, I'm not kidding. When you look at the cervix, when we insert a speculum here, when we do what we call pelvic examination as a clinician, as a doctor, we let the woman assume a lithotomy position like this, leg, foot on the stirrups, and we can insert a speculum. You can see the cervix like this. It's not open, it's closed because you're not pregnant, you're not delivering a baby, right? When the baby goes down here, remember what? Well, this must be another joke of mine, right? When the baby descends, because of the effect of oxytocin, uterine muscle contraction, the vagina is here and the cervix is there. The cervix will dilate because why? The baby's head is like this. It will dilate from 1 cm to 10 cm, right? So as it comes out into the cervix, into the vagina, what happens? So this is the vagina, what happens? Push, push, push. Very painful, but it's okay. As the child comes out, there's so much pain, followed by so much joy. Imagine a baby coming out from you. So I really admire all the women in this world. My mother, you're going to be a future mother, so all of us would not even be here without our mothers. I don't care about my dad, I care more about my mother, you know. So you men, you better be faithful to your wives and they become the mothers of your children. So suffer. How many months? 9 months, right? It's I never got pregnant because can you imagine for 9 months? You have kids?
Yes.
Is it painful when you deliver your baby? Were given epidural?
Yeah.
Yeah, okay. But did it help? Or were you the one who said it did not help?
Yeah, it was only half of my, like.
So that means your anesthesia was not good, you know.
Yeah.
Epidural should have been better, okay? Because once you have, without the epidural, this is what happened during labor pain. Without the epidural, no more babies. Give them an epidural. I like this. What do I need to get pregnant, honey? Next year, honey. Okay, so where is the egg produced? So this is the fallopian tube, the fibrin, the ovaries are here, which you saw in the lab, right? Once a month, it's called ovulation. How do you count ovulation? 14 days after the first day of menstrual bleeding. Let's say the woman has menstrual bleeding from June 1 to June 5. They say it's about 5 to 6 days. I don't really know. I've never had any menstrual flow. So woman, let's say you always count with the first day. It's more consistent. First day is June 1, and June 5 is the last day. You don't count the last day because it could become different from different people. June 1, you add 14 days. June 15, you would expect the egg to be released. It's called what? Ovulation. O-V-U-L-A-T-I-O-N. Now, how do you know the woman is ovulating? Very simple. There's a rise in the basal body temperature by 1 degree Celsius. If you want your partner to get pregnant, it's the best time to have sex. June 15. The problem is that June 15 is how many hours? 24 hours. So I always tell you, if you've been married for 5 years and you have no kids, bring a thermometer with you all the time. So if you are inside the classroom and it's 7:30, oh shit, Dr. Gamo, I am hot. No, not that. My basal body temperature is really hot, 1 degree Celsius. And I will excuse you. Okay, I have reserved a room for you. Your husband is waiting for you. It's my gift to you. If you have a baby, I can be the godfather. You know. I'm just joking, of course. The point, therefore, is ovulation occurs 14 days, but within the 24-hour period, how do you know? The rise in the basal body temperature by how many degrees Celsius? 1 degree Celsius. Right? So I was not kidding about bringing a thermometer all the time. In fact, I have a thermometer here right now. Not for me, but you know. Do you understand? Now, so let's go over each organ here. So, once the egg is released, right? Egg is released. What does the fibrin do? And the egg will be staying where? In the fallopian tube. And what is the egg going to do there? Wait for the gentleman date. So he's wearing a bikini there. Honey, I'm waiting for you. So during the sexual act, during penile penetration, and when the sperm is released, the sperm is going to walk, run, or wiggle. The only thing it does is wiggle, right? Millions of sperm, but it only takes one to what? Fertilize the egg. So remember that movie, Luke was talking? They all travel here, yeah? And then what happens? When the egg is fertilized here in the fallopian tube, what happens with the fertilized egg by the sperm? You develop a what? The zygote travels here, implant on the wall of the uterus. Now, what are the 3 layers of the uterine wall? I think it's also in the study guide. What are the 3 layers? First, this is the uterus, endometrium, myometrium, and perimetrium. Which one has the muscle layer? Because myo means. So where will the oxytocin have an effect? Myo. It will make the muscles contract in order to what? Expel the baby. Do you understand? So when the muscles contract, for those who are pregnant, you know what happens, right? First, it will be maybe every 30 minutes, and the contraction is not that strong. Then every 30 minutes they contract. Then every 15 minutes. Then it becomes every 10 minutes. Then every 5 minutes. And the intensity becomes greater and stronger, and that's the time they complain of severe pain and the baby comes out, okay? At the right time. Is that clear? Yes. So for those of you who had babies and delivered your baby, you know how it's very painful, but epidural, hopefully the pain is not so severe, okay? So, now take note. So we have talked about the ovaries, we have talked about the fallopian tubes, the fibra, at the same time, the uterine wall, right? Endometrium, myo, and perimetrium. That's what we need to cover. So, same thing, you have uterine arteries, uterine veins, right? Just like your kidney, renal arteries, renal veins. And then what else? You probably heard about the cervical cancer. What is the name of the virus treated with cervical cancer? Human papilloma virus. Now, is there a vaccine for that?
Yes.
I don't know. What is the age upon which we inject our?
It's up to the age of 18 and right up until.
So I'm too old for that, right?
Yeah.
I'm 58. I was 18, 40 years ago. So, okay. So, in the women's organs, particularly the reproductive organs, is the male is very simple. If you notice, and I think in the book, if you look at the external female genitalia, women have how many openings? 3. On top, you have what? Urethra, then the vagina, then the anus. Okay. So where do we insert the urinary catheter? So please don't insert it in the vagina. Can that happen? Lots of times. Even doctors make mistakes. They can make mistakes. Insert the catheter into the urethra because the space between the urethra and the vagina is it's so small. But the vagina is much bigger than the urethra, and it's above the anus. The anus, by elimination because of the smell. Okay, anus. Can you imagine? You insert the catheter into the anus. I don't know with your anatomy. You must go back to. Because you need to insert it into the urethra. So you go like this, then how do you know? Because the urine will flow. Now do 2 types of catheter. I don't know if you're familiar with catheters. The indwelling that's yellow with a balloon, and the one that's red or orange, where you just insert, let the flow come out, and then remove. Less chances of developing bladder infection and urinary tract infection. People with indwelling, they have a high risk of developing what? UTI, and that's why you have high fever and you have a dwelling. I always tell my nurses, remove the catheter, fever goes down, bang. So the turbid urine, now you have clear. Pale yellow to amber urine. Do you have any questions regarding, did we cover everything in the study guide for the female reproductive organs? I think we did, okay. Do you have any questions? It's almost 8, I will dismiss you early because we don't even actually have this. I think maybe, I don't even know why I should be here. Okay, are we good? So we're done?